Hey, I'm going to talk to you today about childhood ear infections, or what we call otitis media. Now, it's very common, and it's never normal to have childhood ear infections. Now, we all know childhood ear infections because they're tugging at the ear. They're usually crying, they're in pain, they're fussy. It's never fun when your child has an ear infection. Let me start. Well, if you don't know who I am, my name is Dr. Chris Chase. I am a chiropractor here at Savita Chiropractic in Derby. And you may be wondering, why is a chiropractor talking about childhood ear infections? Well, let me tell you why. A good place to start is the anatomy of the ear. Now, you know there's the outer ear, there's the middle ear, and then there's the inner ear. There's also what's called Eustachian tube. Now, this tube connects your ear to the nasopharynx, or the back of the throat. So it allows fluid to drain from the middle ear down to the throat. And it also equalizes pressure. You know that when you go into a plane or you go on a high altitude, you have to do this to equalize the pressure in your ear. That's what that tube does, Eustachian tube does. It normalizes the pressure and it allows fluid to drain, and actually prevents reflux or fluid going from the nasopharynx up to the middle ear. That's its job. Now, there's 4 muscles that surround that Eustachian tube. Two of them are very important. I'm going to talk about today. It's called the tensor veli palatine muscle and also the levator veli palatine muscle. These help. Think of this tube as like a check valve, and it opens and closes the valve. Now, Eustachian tubes open and closes when you chew, yawn, swallow. It opens and closes to normalize the pressure. Now, in adults, it's really not a big deal because, see, the anatomy is the tube slopes down like this. Okay, so downhill, water goes downhill, right? So all the fluids from here goes downhill. But in infants and babies under 2 years old, it's more horizontal. It's kind of a little floppy. So it doesn't drain very well. So if it doesn't drain very well, what do you think happens, right? Fluid buildup. And that fluid buildup can lead to an infection, otitis media. Now, you can have it in one ear, or you can have it in both ears, and it's a problem. So the common solution is to go to the pediatrician and to get some decongestants, maybe some steroids or antibiotics. And if it's recurring over and over and over again, they may suggest tubes in the ear to help equalize that pressure. That's the common treatment. So why am I talking about it as a chiropractor? Because as a chiropractor, we work with the nervous system. And as you know, the nerves control and coordinate everything in the body. Muscles, glands, tissues, organs, everything. So the nerves that come from here, and it's called the vagus nerve, goes to those 2 muscles I talked about, and it helps open and close them, or contracts them to open and close Eustachian tube. So what happens is if you have a misalignment, if your child has a misalignment, or what we call a subluxation, that can irritate that nerve, and of course the communication from the brain down to that muscle doesn't work properly. So that tube doesn't open and close properly, and it remains closed. It could back up, get infected, could cause an ear infection. So you may be asking yourself, how does my child get these misalignments? Well, probably the birth process. I mean, it's pretty rough, especially if it's a C-section or a forceps extraction or a vacuum extraction or just a long birth. I mean, think about it. Each contraction, the baby's head's going against your pelvis. It's going to misalign the spine. Could. Also, the infant, the baby, the muscles aren't fully developed yet. And you see the baby flops all over the place. That's why you have to gently cradle the neck. That's why, because they have no control. So maybe some, babies are slippery and wobbly, and something may happen, it might shift, and they could misalign the spine. Is this something that, as a parent, you should be concerned about? Yes, especially when you look at their posture. If you're breastfeeding or feeding the baby, and they're only going to one breast but not the other, or they're fussy with the other one, maybe because, or their posture, they always have their head tilt like this or shifted like that. If they're stuck, if they look like they're stuck like that, there's probably a misalignment in their neck. And that can irritate the nerve, the vagus nerve, that goes to the muscles that surround the Eustachian tube and prevent the Eustachian tube from working properly. Allows fluid to build up, and it could get infected. So what I do as a chiropractor is I find that misalignment and I gently adjust it. Now it's gentle, it's safe, it's effective for infants. Now listen, I'm not treating ear infections. As a chiropractor, we don't do that. What we do is we find the misalignments in the spine. And if the child has a misalignment, then we correct that misalignment and allow the body, the nerve, the communication between the brain and the body to go through, allowing those muscles to work properly. That's all we do. So if your child is having chronic ear infections, it just won't go away, and you've done everything, you've changed diet, you've taken the medication, you've done everything the pediatrician has told you to, and now maybe you're looking at surgery for tubes and ears, then consider it may be a misalignment in the spine. So consider our office. So what I want you to do, if you want to get more information about what we do in the office, then please give me a call. The number is 203-736-6356. And if you found this information helpful, enlightening, you learned something new, then share it with a friend or family member that may have a child that's going through this. Again, I'm Dr. Chris Chase. I'm your chiropractor in the Valley. Have a great day. Bye.